Hello everyone, Homeopathy Heals welcomes you in the part 4 of diabetes mellitus. As we have already learned about the types and causes of diabetes mellitus, sign and symptoms, complication, desired investigation and management of diabetes. So in today's video, we'll be learning about homeopathic therapeutics for diabetes. So let's get started. First of all, acid phos is a very good remedy and when given in lower potencies can cure diabetes mellitus in early stages. Another remedy is Avena sativa. This remedy is very much useful in decreasing the absorption of glucose in the blood. It helps in decreasing the absorption from intestine. Another remedy is Cephalindra Q. This is the remedy for diabetes mellitus of both type 1 and type 2. Think of Crataegus when diabetes mellitus is present in small children. Give 5 drops in half cup of water 4 hourly till it cures. Another remedy is Gymnema mother tincture. Mother tincture is used when patient has diabetes mellitus along with he abolishes the taste of food. There is no taste or smell of food. Along with patient passes a large quantity of urine. That is a very common symptom of polyuria in cases of diabetes mellitus. Next come Helonias. Helonias is an excellent remedy for diabetes mellitus when it is associated by weakness, restlessness, emaciation, melancholy and polydipsia. Patient craves for a large quantity of water. Next comes insulin in low potency 3x or 6x. I use in practice very frequently, but prolonged use of insulin may cause a weakness in the patient. So you should be very careful while prescribing Sarcode insulin to the patient complaining or a known case of diabetes mellitus. When diabetes mellitus is associated with nausea, vomiting, diarrhea, stomachache, dyspepsia or constipation, think of Iris versicolora. When diabetes is associated with hunger, dry mouth, dry throat and rheumatic pains, think of lactic acid. Filorhizium 2x, when given with Syzygium jumbolum, it can check blood sugar level and also the passage of sugar in urine. Another one is uranium nitricum. It is a very excellent remedy because it controls blood sugar along with blood pressure. It is much indicated when diabetes mellitus is associated with defective digestion. Patient is unable to digest even simple form of food and patient is yet hungry, thirsty, but he is losing flesh. He is emaciated even if getting a lot of hunger. Remedies to prevent the complication and recurrence, you should never miss the reports that I told you, the investigation HbA1c in the patient. When HbA1c is below 6, it is normal. When it is highly controlled, then patient should be managed with the diet and similimum should be given in the medium potency. When HbA1c is between 6 to 7, it is not that fairly controlled, then preferably nosode like Midorhinum in very high potency, in 10 m potency, one dose should be given and results should be awaited of. Another one, when HbA1c has the reading like 7 to 8, then remedies like Nux moschata, phosphoric acid, they come into the role. In cases of complication of diabetes mellitus like retinopathy, think of phosphorus or causticum. Make sure that you never follow phosphorus and causticum as we know that they both are inimical to each other. In cases of nephropathy, think of eel serum and terebinth and both in 30 potency. You have to keep the potency low because the pathology is becoming gross in cases of complication of diabetes mellitus. In cases of neuropathy, then Califos 6x and Symphytum should be thought of. Remedies like Midorhinum, Cephalinum, sulfur, that too in very high potency like 1m, 10m, 50m can be very helpful in cases of recurrence or to prevent the recurrence of diabetes mellitus. I hope you liked the video, and the question for today's video is that you have to tell that how many complications of diabetes mellitus, how many complication of diabetes mellitus we have discussed in this video along with the remedies. So share with your friends, like, comment in the section. Till then, we wait for our winners. Stay fit, stay healthy. Homeopathy heals.